That was epidemiologist Dr. Michael Osterholm, member of President Biden's COVID-19 Transition Advisory Board, sounding the alarm about a fourth wave, despite the U.S. hitting a record number of single-day vaccinations. Is he right? Here now, Dr. Mark Siegel, professor of medicine at NYU Langone Health. He's also a Fox Business contributor. A new pandemic, Dr. Siegel.
No, he's wrong, Dagan. Let me tell you why he's wrong. Let's crunch some numbers here. Let's look at Israel, where 60% of the population has now been vaccinated, and yesterday there was 170 cases and 7 deaths. Or the United Kingdom, where 50% of the population has been vaccinated. Now, UK is 7 times the size of Israel, but in UK you had about 2,200 cases and only 10 deaths. So clearly, when you get up to around 50 or 60% of the population being vaccinated, you start to see a tremendous drop-off, even with the B.1.1.7 variant he's talking about. Here in the United States, we're currently at 32% people have had at least 1 shot, 17% have had 2 shots. When we start getting up around 50, 60% or more, you're going to see a dramatic drop-off. Right now, the states that have seen the surges haven't been vaccinated enough, and we need to focus more on them. The rollout has been good lately, and it should continue, hopefully, if we can overcome noncompliance.
The most vulnerable part of the population, too, are older Americans, those over 65. And as a percentage of the population, 3/4 of people over 65 have gotten at least 1 dose of a vaccination. And I'll also point out, on Sunday, according to Johns Hopkins data, there were 222 deaths. 1 death too many, obviously, but that was the lowest number of deaths in a day in more than a year. So to talk about this is a new pandemic or a fourth wave just seems like it's intentional panic peddling.
That's a very good point you just made about the deaths. I like to say that we're converting the pandemic here currently into a milder pandemic with what you just said. We're seeing the spread still, certainly with spring break, but the vulnerable populations, especially the elderly, who accounted for over 80% of the deaths throughout the pandemic, are now pretty much covered, mostly covered, and we're going in the right direction with that. I agree with you. We're going to see milder and milder cases until we start to see a big drop-off in cases, same as Israel, same as United Kingdom, in probably about a month from now if we can continue this rate of vaccination.
One thing that gets me fired up, Dr. Siegel, is there has been so little communication, particularly from the federal level, from the Biden White House, to people who, what do you do if you contract COVID? There has been so little utilization of antibody therapies. Now, I know that, that at least one of them, a single antibody therapy, doesn't work well with these variants. Nevertheless, there needs to be messaging to people. If you get COVID, what do you do? Because if you don't reach out to doctors, you get an email or a text message from whatever place tested you that says, go home and sit there for 14 days. And I just think it does a disservice to anybody who contracts this virus.
Former FDA Commissioner Scott Gottlieb wrote about this in the Wall Street Journal today. Very, very important point you're making. We do have therapies, yet they have to be given very early in the game. The monoclonal antibodies do work. You're right, there's a problem with the variants, but they're being re-engineered for that. So we can see and test and see if it fits you, but it's got to be very early in the game. Other medications, small molecules are coming out. We're going to have more in our armamentarium. We have steroids to use. We have some antiviral drugs to use. Remdesivir, not as good as we had hoped, but we do find that it has some value. Clearly, the earlier we diagnose COVID, the better, and we do have treatments.
Dr. Siegel, it was great to see you. Thank you so much. Dr. Mark Siegel, we'll see you very soon.